Hello, I'm Dr. Sam, and today I'm going to dive into a study on if strength exercise can help relieve chronic tension type headaches. I'll start by giving a summary of the study, describing what they were measuring, who was being studied, and what the results were. Then at the end, I'll demonstrate the program with instructions for each of the exercises. I'll also then upload the exercises as a separate video, as a standalone video, so you can follow along there so you don't have to keep watching this video. The name of this study: Efficacy of a Strength-Based Exercise Program in Patients with Chronic Tension Type Headache, a randomized controlled trial by Martin Vera and colleagues. I'll put a link in the video descriptions for your reference so you can see what the study was. This study, what it did was take a 12-week strength program for patients with chronic tension type headache. What they did was it was a randomized controlled trial. They took 40 participants, 85% of them were women with an average age of 37 years. In the study, the study broke those 40 participants into two groups, an intervention group and a control group. The control group just was told to do their normal activity. But in both groups, the diagnosis for chronic tension type headache was confirmed by a neurologist as well. The intervention group, they took part in a 12-week strength program that focused on muscles of the neck and the shoulder regions. They performed the exercise protocol twice a week for the first 6 weeks, and then they performed it 3 times a week for the last 6 weeks. The outcomes that they were measuring in this study were common headache characteristics such as headache frequency, headache duration, headache intensity, but they also looked at neck muscle thickness, neck range of motion, pain pressure thresholds, and neck strength and endurance. The measurements they took for this were done at baseline, so before they started the study, and at the end of the study at 12 weeks. So what were the results? So for the group that did the exercise, showed a significant reduction in headache intensity and headache duration compared to the control group. The frequency of headaches in the exercise group decreased from 10.1 days per month to 7.4 days per month, resulting in a total reduction of 2.7 days per month. But the authors in this study didn't consider that a significant reduction compared to the control group. Participants in the intervention group did also experience, though, increased neck muscle thickness, significant improvements of deep neck flexor strength, increased range of motion, as well as increased pain pressure thresholds to the temporalis, the upper traps, and the masseter muscles. So it's important to note that there was a high compliance with this exercise program. So a lot of people kept up with the protocol as it was designed, and there were no adverse effects reported during this study. So just to summarize everything, it was a 12-week strength program focusing on the neck and the shoulder regions to reduce headache intensity and headache duration. That also resulted in increased neck muscle thickness, deep and neck strength, as well as improved neck range of motion, and increase your pain pressure thresholds of common muscles involved in tension headache. So I'm going to demonstrate the exercise protocol for the studies, but please remember this video is for educational purposes and is not for personalized medical advice. So always consult your healthcare provider before starting any new exercise program. So here are the exercises. So let's review the exercise protocol for this. It was a 12-week program. All the exercises were performed 2 days a week for the first 6 weeks and then 3 days a week for the remaining 6 weeks, with at least a 48-hour time difference between sessions. So for the intensity that you're looking to do a 7 out of 10 on the Borg Scale, which is something like hard or vigorous effort with these exercises. So for the Borg Scale, participants are usually measuring from 0, which is no effort, to 10 being the highest effort possible. For the sets and reps that we're doing 3 sets of 8 to 10 repetitions for all of these exercises. In this study, they report doing a joint mobility warm-up before getting into the exercises that focuses on the arm and the neck. No further detail was really provided for that, so I'll just do my own warm-up of my own design of what they think they might mean. After the warm-up, they go into the strength exercises. After the strength exercises, they move into the neck isometric exercises. So I'm going to demonstrate the exercises as they have pictured in that study. So if you go to the link, you'll see what I mean. Not really how they're named in the study because it's kind of extra confusing because they use different terminology for it. So for the shoulder exercises, they're using a TheraBand like this. They're doing shoulder abduction or a lateral raise, a horizontal row, a vertical row, or also known as an upright row, and a horizontal abduction or a band pull-apart exercise. And they're using a TheraBand again like this, and they're choosing a resistance level that again achieves a 7 out of 10 on the Borg Scale, so you need to find what works for you for that. With the exercises performed for the isometric exercises are flexion, extension, and lateral flexion, and then we're holding those movements for 6 seconds in a contraction. For a 7 out of 10 Borg scale, I would say that's probably about a 70% effort in contraction. So let me demonstrate what I'm going to do. I'll do a warm-up, and then I'll do the shoulder exercises, and then the isometric exercises. So for my neck warm-up, what I would do is just start with some nodding, back and forth, and neck flexion and extension. Doing anywhere from like 5 to 10 repetitions. Then I'm going to do rotations, 5 to 10 to each side. Now, if this makes you dizzy, go slow or just avoid it altogether. Right? After neck rotations, I'll just do some lateral flexion, similar to warming up the muscles that I'm going to be working on strengthening. And I'll do some shoulder warm-ups. I'll just do some shoulder rolls, just up and back. Get my muscles and my shoulder blades ready to start working in these exercises. Do some lateral raises. Do some front raises. All right. I'm gonna start getting into the strength exercises now. So I'm using a TheraBand like this. You can use one with handles if you want. And really you're just looking for a resistance that's about a 7 out of 10 on the Borg scale again. So the first one is shoulder abduction. So I'm gonna be taking the band, and I know you can't probably see that low, but you're just gonna stand right in the middle of the band. Arms are gonna be down to your side, and you're gonna raise out right to shoulder level and then back down. You're gonna do 8 repetitions. So that's 1, 2, 3, 4, 5, 6, 7, 8. Now you can do 8 to 10, so depending on how strong you feel that day, if you can do 8, 9, or 10. If you feel like you can't do those repetitions, then that band is probably too hard for you. If you can do way more than 10, that's probably too easy for you. And again, that's 3 sets, so really I would rest about 30 seconds to a minute and then do another set and repeat that process. Once I complete it, I'm going to move on to the next exercise. So I'm not going to do the other 2 sets for that exercise. I'm just going to move into the next one, which is band pull apart. So you'll just hold that band straight in front of you like this, and you're going to pull apart until the band touches your chest, trying to keep your arms straight and pulling your shoulder blades back together. And then coming slowly to again forward. So it's 1, 2, 3, 4, 5, 6, 7, 8. Right? I'm going to rest 30 to 60 seconds and then do and repeat again. Now move on to the horizontal row. In the picture, they demonstrate somebody kind of bending over for that, so I'll demonstrate that real fast. But usually what I would do is just wrap it around a bar or put it into a door so that you can do the row that way. So the way they have it pictured in the study, you're standing in the middle of the band, you're slightly flexed forward, and you're rowing upwards, right? Pulling kind of like your thumbs towards your armpits. I don't really like that position as much for the horizontal row. I think it's a little bit awkward, and for some people with headache disorders, that head down position may not be very comfortable. So I'm going to do a horizontal row this way instead. So I put it around either put it in a door or around a banister if you're doing this at home. Standing back, and you're just pulling straight and out. 2, 3, 4, 5, 6, 7, 8, 9, 10. Right. And resting 30 seconds, repeating that. The next one is a vertical row or the upright row. So with this one, you're going to stand in the middle of the band, both hands just down by your side. You're going to lift up to shoulder height like this and back down. They also note it in the study as like a bird exercise. But the vertical or horizontal or vertical or upright row is what I would call it. And I'm doing 10 of those. So 3, 4, 5, 6, 7, 8, 9, 10. All right. Now I'm done the shoulder exercise routine. I'm going to move on to the neck isometric exercise. They talked about a 6-second hold, but they didn't really specify if the sets and reps were different than the shoulder exercises. So I'm going to assume, based on how the study reads, is that I'm still doing 3 sets of 8 to 10 repetitions. Now I'm just adding in a 6-second hold. giving about 70% effort in the exercise. So the first one is a neck flexion exercise. So I'm going to put the heel of my hand right across my forehead, right around where my brow is, and I'm going to push in a kind of like a forward but downward manner at the same time. So I'm going to push forward, hold for 6 seconds. So 1, 2, 3, 4, 5, 6. Rest, just pause, and again. 1, 2, 3, 4, 5, 6. That's 2 repetitions. You would go up to 8. I'm not going to demonstrate the 6-second holds for all of this because that's just going to take too much time. Then extensions. So I'm going to take one hand or both hands, put them on the back of my head, just below, just above where the muscles of the suboccipitals are, the muscles of the base of the skull, and I'm going to push back into that and hold for 6 seconds. 1, 2, 3, 4, 5, 6. Pause and release. And push back again. 1, 2, 3, 4, 5, 6. With that effort, again, about 7 out of 10 on the Borg scale, or 70% effort in pushing back. You're not moving with these exercises because it's an isometric, which means you're not moving, you're holding still and just kind of pushing against self-resistance. And then lateral flexion. So here you're going to take the heel of your hand, put it right above your ear, and you're going to try to take your ear to your shoulder. So it would be this motion, but you're pushing against the hand. 1, 2, 3, 4, 5, 6. Pausing, and again. 1, 2, 3, 4, 5, 6. And then you would do the opposite side. So hand above the ear, pushing 70% effort. 1, 2, 3, 4, 5, 6. Pause, and again. 1, 2, 3, 4, 5, 6. And pause. Again, I was only doing 2 repetitions there just for demonstration purposes, but normally you would do 8 to 10 repetitions for 3 sets, taking a 30 to 60 second break in between, right? So try those exercises out if you feel like you're able to, or your physical therapist prescribes them to you. If you feel like they're helping you, let me know. If you have any other questions or want further demonstrations, just add it to the comments below.